Hi guys, welcome to Mystery Diagnosis.
Peggy began feeling short of breath.
Feeling of tiredness, the fatigue, and she just lacked the normal zest that she had.
One day, while refereeing a soccer game, Peggy senses something really is wrong.
As I was running and I would come to a stop, there was just a sharp pain in my knee. And then it gradually moved into both knees.
The next day, while typing at work, Peggy feels the same sharp pains in her thumbs.
And sometimes to my elbow. I explained it to myself as possibly being arthritis or just being on the keyboard too much during the day.
After an examination, she is diagnosed with a mild form of carpal tunnel syndrome.
For people who are new to my channel, with Mystery Diagnosis, the diagnosis towards the end is the correct ones. The ones early on, you have a bunch of false diagnoses.
A month after her appointment, Peggy feels no better. A few weeks later, while on a trip with her sisters, they notice a strange new symptom. Peggy's ankles and calves are swelling uncontrollably.
They reminded me of pregnant women where their ankles swell to like 3 to 4 times the size that they normally are.
By the time she returns home a few days later, Peggy's hands and fingers have swollen up too. Unable to use her hands, Peggy's family has to help her do simple everyday things.
She started having trouble tying shoes,
Yeah,
just
that's
putting on her clothes,
hard 'cause it's
buttoning
embarrassing.
things.
Concerned, Peggy returns to her primary care physician. Dr. Leshak orders x-rays of Peggy's hands, feet, and knees. A week later, the results are in.
The results were normal.
Why I was swollen and why it hurt to walk.
Over the next few weeks, Peggy returns to her primary care physician and countless specialists. But still, no one can explain what's happening to her body.
One doctor suggested I was depressed. Another doctor just thought that it was a flu. One doctor thought that I had a bowel problem. I, at that point, was almost in tears.
What we
Now
wanted
you
from
know
the
why
doctors
it's called
was a
Mystery
diagnosis. We didn't want to hear depression. Depression isn't causing the legs to swell, the knee joints.
She also was having some changes in her fingers with cold exposure, that they seemed to becoming pale or a bluish discoloration, which sounded like Raynaud's phenomenon.
I know what this is.
Dr. Leshak has a hunch that Peggy is suffering from an autoimmune disease.
I agree.
Thickened skin of her finger.
It's scleroderma.
Scleroderma, which means hard skin, is an autoimmune condition affecting connective tissue throughout the entire body. It occurs when the immune system, which normally protects the body from germs, goes into overdrive and attacks healthy tissue. This produces inflammation and an overproduction of the protein collagen. The excess collagen deposits in the skin, causing it to harden, and in the joints, causing pain.
The collagen can also form in the internal organs, like the esophagus, but the way Mystery Diagnosis explains it, I couldn't add it.
But the happiness doesn't last long. Dr. Leshak has some bad news.
There's no cure or treatment.
It's one of the more frustrating autoimmune diseases. There certainly has been a lot of advances in the treatment of scleroderma. But at this point, there is no cure. There is no real disease-modifying really can make a difference.
I thought, no, I've got to find something.
Peggy independently sought out a study at UCLA,
Good for her.
which has a world-renowned scleroderma specialist, Dr. Philip Clements.
Dr. Clements immediately enrolls Peggy in a year-long study to test a new drug that might slow down the progress of the
That's
disease.
good.
Peggy must take the drug every day for a year and come in every few weeks to get tested.
A couple of weeks into the program, I noticed that the breathing in, it didn't hurt. It was actually really exciting.
That's wonderful.
It's now been a year since the clinical study ended, and the drug hasn't been approved yet. Peggy is on a different medicine to control her symptoms and is still being closely monitored.
I feel really good. I mean, I do have my bad days, of course, but overall picture, I feel really good.
But Peggy knows she isn't out of the woods yet. It can take up to 5 years for scleroderma to fully evolve. Since she's in her 3rd year, Peggy doesn't know how many more symptoms she will experience.
There's still going to be some changes. Over the past year, my hands have contracted where they have now, I
Poor
can no longer
thing.
straighten them out.
In Peggy's case, the long-term prognosis is still a little open to question. The more time that goes on, if your lung function remains pretty good, your heart function, your kidney function, you're in a pretty good place.
There's no healing in scleroderma, but with
I
all
wish
the
there was.
researches that are going on, who knows, they may find a cure.
Right.
Peggy is just loves life and enjoys each and every day.
I try to think I haven't changed at all. I
Oh,
think
you're
I'm
so
still the
sweet on
same
this
person
side.
on the inside, just a little different on the outside, that's all.
She looks the same to me. This might seem random, but every month I say I would tell you a random fact about me. My favorite anime is Naruto Shippuden. I meant to do a video yesterday, but I'm having trouble with the authorized part of my psoriatic arthritis. 2 weeks of psoriatic arthritis pain and not recording twice is great. Don't worry, I'll still be posting videos. They may not be every day, but they'll be almost every day for a little bit. What I mean is like upload one video for 4 or 5 days. It's not permanent, it's just for a bit or when my psoriatic arthritis or a health problem pops up. Thank you for watching. Make sure you hit the notification bell and comment, and I'll see you next time.